Hi, I'm Naturopath Dr Julian Neil. Today I want to address what every woman should know about breast health, beyond mammograms and beyond cancer. Breast health is often reduced to those two words, mammogram and cancer. But the breasts are not just sites of potential pathology. They are actually living, responsive tissues that deserve care, awareness, and reverence throughout all the stages of a woman's life. As a naturopathic doctor, I invite my women patients to shift their relationship with their breasts from fear-based monitoring to embodied, loving connection. Breast health isn't simply about detecting disease. It's about creating the conditions that support vitality, flow, and balance. I consider that the breasts are an extension of the heart. In both Eastern and Western traditions, the breasts are considered energetically linked to the heart center. They are vessels of nourishment, emotional expression, and feminine wisdom. Their tissue is highly sensitive to hormonal fluctuations, emotional stress, lymphatic stagnation, and environmental toxins. Just as the heart responds to how we love and live, the breasts do as well. When medically speaking about the breast, we always must consider three things: hormones, lymph, and liver. So let's look at the inner landscape of breast health. First, hormonal harmony. Estrogen plays a key role in breast tissue development, but excess estrogen, whether from poor detoxification, chronic stress, synthetic hormone exposure, xenoestrogens, or imbalanced progesterone, all can contribute to tenderness, cysts, and fibrocystic changes. Supporting hormonal balance then is essential, and this includes a nutrient-rich, fiber-filled diet to help excrete excess estrogens. Cruciferous vegetables like broccoli and kale, which provide compounds such as DIM and sulforaphane to assist in estrogen metabolism. Addressing chronic stress and stabilizing cortisol, which otherwise suppresses progesterone and disrupts the estrogen-progesterone dance. Second, we look at lymphatic flow. The breasts do not have their own lymphatic pump. The blood is pumped by the heart, but we are the pump of the lymphatic system. So movement, breath, and touch are what encourage lymphatic drainage. Without this flow, toxins and metabolic waste can accumulate in the breast tissue. And we support this by daily movement, especially bouncing or gentle rebounding. I always recommend to all my patients to use a trampoline or a rebounder for the lymphatic system. Dry skin brushing from the armpits towards the heart. The skin in naturopathic medicine is considered the third kidney. Do a daily self-breast massage with natural oils such as castor, calendula, or rosehip. Wearing non-restrictive bras or going braless whenever possible is also recommended. And third, we look at liver support. The liver is the body's primary hormone filter and is the hardest working organ in the body. I always tell my patients, if you want to live, take care of the liver. If it's overburdened by toxins, a poor diet, or stress, it cannot efficiently process hormones. So we support that with bitter herbs, dandelion, burdock, or vegetables like asparagus and artichoke. We hydrate with lemon water, especially first thing in the morning, or we use herbal teas. We avoid endocrine disrupting chemicals. Now, this is important as, for example, preservatives in food are estrogen mimickers and can also overload the body with estrogen. The same is true in plastics, body care, and household products. We must also recognize the emotional imprints in the breast. Breast tissue is highly receptive, not only biologically, but emotionally and energetically, or what I consider spiritually. Many women store unexpressed emotions such as grief, resentment, or nurturing that has nowhere to go in the breast. In psychology, we know the heart center holds murderous rage, deep longing, extreme sorrow, and extreme joy, all the heavy stuff. So mind-body practices like breath work, somatic therapy, or expressive journaling can help release these stored emotions and promote emotional/spiritual breast health. I also encourage my patients to have breast awareness versus fear-based surveillance. Breast self-exams don't have to be clinical or anxiety-driven. Make them a monthly ritual of self-connection done during a warm bath, for example, with an intention and with care. Learn what is normal for you. Trust your hands, your intuition, and your awareness. It is also important to provide holistic breast nourishment. That means essential fatty acids from things like flaxseed, evening primrose oil, wild fish oils, or even an omega supplement. Magnesium and iodine, both critical for tissue health and hormonal balance. Reishi mushroom and turmeric, biocircumin, which are navigators of natural anti-inflammatories and immune modulators. Sunshine and vitamin D, essential. These support immune function and breast tissue resilience. Here are my final thoughts. The breasts are not medical problems waiting to happen. They are sacred parts of your being, deserving of attention, affection, and care. True breast health is about honoring your body's wisdom, supporting its natural detoxification systems, and cultivating hormonal balance and emotional peace. When women care for their breasts as extensions of their heart and heart center lovingly, naturally, and intuitively, they shift the conversation from fear to empowerment, from detection to prevention, and from silence to self-trust.